There is a profound lie that our culture tells about aging, a quiet deception that suggests as the hair thins and the years accumulate, our sexual nature should simply fade into the background. I'm Dear Emily Carter, and as a specialist physician who has spent decades working with men in their 50s, 60s, and beyond, I have seen the damage this silence causes. Many men navigate a world filled with outdated myths and a distinct lack of clear, reliable information, often practicing self-pleasure in the dark, unsure of how it affects their hormones or their prostate health. This topic is surrounded by confusion, yet it is one of the most common unspoken concerns for men in their mature years. Today we are going to break that silence with an honest, science-based conversation because your sexual health is not a separate entity from your overall well-being. It is a vital indicator of your vitality. Before we dive into the deep mechanics of the body, I want to invite you to join our community here at ElderWell Living. If you find this information helpful, please hit the like button and subscribe to our channel. Your engagement helps us reach more men who may be struggling with these same questions in isolation. I also encourage you to share your thoughts or questions in the comments section. What is the one thing you have always wondered about sexual health and maturity but felt you could not ask? Let us start that dialogue right now. When we look at the available data, it becomes easy to see why so many men feel uncertain. While studies show that a majority of men over the age of 60 continue to practice self-pleasure, they often do so with a lingering sense of guilt or fear that they might be causing invisible harm. This fear is largely unfounded. In fact, research suggests that maintaining an active sexual life, including masturbation, can be one of the most significant things you do for your long-term health. We are talking about a practice that, when done mindfully, maintains the physical integrity of your body, protects your internal organs, and balances your brain chemistry. We must recognize that the brain is the largest sex organ in the human body. By regularly engaging in sexual fantasy and physical stimulation, you are keeping the neural circuits associated with desire and arousal active and firing. This is crucial because it helps maintain a healthy libido and sexual responsiveness, even if you do not currently have a regular partner. Think of your sexual health like a complex machine. If you leave it idle for too long, the parts begin to stiffen, and the systems that were once fluid become sluggish. Regular use is the key to longevity. The benefits we will discuss today are rooted in clinical findings. For example, the act of achieving an erection is a form of physical therapy. It increases blood flow into the spongy tissues of the penis, known as the corpora cavernosa, which helps maintain tissue elasticity. This elasticity is exactly what allows you to achieve and sustain firm erections as you age. Without this regular exercise, the tissues can become less pliable, making future performance more difficult. Furthermore, we cannot ignore the profound impact on the prostate. Multiple large-scale studies, including a landmark one from Harvard University, have linked higher ejaculation frequency with a significantly lower risk of developing prostate cancer. The prevailing theory is that regular ejaculation helps flush out potentially harmful substances and secretions from the prostate ducts. It is a natural cleansing process that your body is designed to perform. When you understand these biological imperatives, the shame and confusion start to melt away, replaced by a sense of proactive self-care. As we move through this journey today, I will walk you through the surprising benefits of masturbation and maturity, but I will also be very transparent about the potential risks. A healthy practice is a conscious practice. We will cover everything from the release of feel-good neurochemicals like dopamine and oxytocin to the practical ways self-pleasure can help you detect early signs of physical issues. We will also discuss the importance of moderation and the risks of desensitization or social isolation. My goal is to empower you with the knowledge to make informed decisions about your own body. This is an essential journey of discovery that could change your perspective on aging and your health forever. To understand why sexual activity remains so vital as we age, we have to look closely at the vascular mechanics of the male body. As a physician, I often tell my patients to think of their circulatory system as a complex network of highways. When you achieve an erection, whether through partnered sex or self-pleasure, you are essentially initiating a maintenance cycle for your pelvic vascular system. The act of achieving an erection increases blood flow into the spongy tissues of the penis known as the corpora cavernosa. This is not just a matter of pleasure. It is a fundamental biological necessity for tissue health. Think of it as a form of physical therapy for your most intimate anatomy. This regular exercise helps maintain tissue elasticity, which is absolutely crucial for achieving and sustaining firm erections as you age. When the corpora cavernosa are regularly filled with oxygenated blood, the tissues remain supple and responsive. Conversely, prolonged periods of inactivity can lead to a gradual loss of elasticity. By engaging in regular stimulation, you are actively resisting this process and ensuring that the physical structures required for sexual function remain healthy. Beyond just the local benefits to the penis, masturbation improves blood flow throughout the entire pelvic region. This enhanced overall pelvic blood circulation is beneficial for the health of the bladder, the prostate, and the surrounding musculature, preventing issues related to stagnation and poor circulation. In my clinical experience, men who maintain active pelvic circulation often report a better sense of physical connection to their lower body. Just as you walk to keep your heart and legs strong, regular sexual stimulation keeps your reproductive and urinary systems in peak condition. One of the most remarkable aspects of this biological engine is its impact on the autonomic nervous system. The relaxation response that follows self-pleasure helps reset the body's balance. Research has shown that orgasm leads to a significant drop in cortisol levels. Lower cortisol helps regulate blood pressure and reduce anxiety, making it a natural tool for cardiovascular and mental well-being. This means that by taking care of your sexual health, you are indirectly supporting your heart health. Furthermore, we must discuss the use it or lose it principle in a neurological context. The brain and the genitals are constantly communicating. By regularly engaging in physical stimulation, you are keeping the neural circuits associated with desire and arousal firing. This helps maintain a healthy libido and sexual responsiveness, even if you do not have a regular partner. It is much easier to maintain a function than it is to try and regain it after years of dormancy. This is why I encourage my patients to view self-pleasure not as a lonely habit, but as a proactive health strategy. In terms of implementation, the frequency of this physical therapy varies, but consistency is key. You do not need to overdo it. Rather, listen to your body's signals. If you find that achieving an erection is becoming difficult, do not ignore it. While self-pleasure is a tool for maintenance, a persistent inability to achieve an erection even during self-stimulation can be a warning sign of underlying issues like heart disease, diabetes, or hormonal imbalances. If you notice this pattern, it is essential to see a doctor to ensure your biological engine is getting the professional attention it needs. We also need to address the practical side of maintaining this health. Because aging skin can be more delicate, it is vital to be gentle. The first risk to avoid is skin microlesions, which happen when masturbation is performed too aggressively or without adequate lubrication. These tiny tears can cause irritation and inflammation. The fix is simple. Always be gentle and use a quality water-based lubricant to protect the tissue you are trying to keep healthy. By combining the right technique with a clear understanding of the biological benefits, you are turning a private moment into a powerful act of medical self-care. In my years of clinical practice, one of the most common questions I receive from mature men regarding their sexual habits involves the health of the prostate. There is a persistent myth that sexual activity somehow wears out this vital organ, but the scientific reality suggests otherwise. When we discuss the prostate shield, we are referring to a body of evidence that suggests regular ejaculation is one of the most effective natural ways to maintain prostate health. This is backed by multiple large-scale studies, most notably a landmark study from Harvard University. The findings of this research were groundbreaking. The study linked higher ejaculation frequency with a significantly lower risk of developing prostate cancer later in life. The biological mechanism behind this protection is the theory that regular ejaculation helps flush out potentially harmful substances and secretions from the prostate. It is a natural cleansing process that prevents stagnation. For men in their 50s and 60s, where the risk of prostate enlargement and cancer naturally begins to rise, this natural tool for prevention is invaluable. Think of the prostate as a glandular system that requires regular turnover. In the case of the human body, potentially harmful secretions can find their way into the prostatic fluid. By maintaining a regular practice of self-pleasure, you are effectively performing a biological flush of these ducts. This process of regular drainage keeps the gland in a state of healthy renewal rather than stagnation. It is a proactive step that supports the body's natural maintenance cycles. It is also important to understand that prostate health is closely tied to the health of the entire pelvic floor. When you reach climax, the pelvic floor undergoes rhythmic contractions. These contractions help engage key muscles like the pubococcygeus muscle. Beyond potential cancer prevention benefits, regular activity can also help manage the overall health of the pelvic region by preventing stagnation and improving circulation. Keeping the system active can help reduce the feeling of pelvic congestion or heaviness that some men experience. I often hear from patients who feel that they should save their energy or that their body has a limited supply of sexual vitality. I want to reassure you that your body is designed for regular movement and renewal. By choosing to engage in self-pleasure, you are not depleting yourself. You are supporting a vital organ that requires activity to stay healthy. This shift in perspective from a shameful habit to preventative health care is often the most important step a man can take for his long-term well-being. Of course, moderation is still a key factor to consider. While frequent activity has benefits, you should always listen to your body's signals. If frequent activity leads to a feeling of aching or heaviness in the pelvic area, known as pelvic congestion, it may be a sign to scale back and find a rhythm that feels restorative rather than exhausting. The goal is consistency over time, not pushing yourself beyond comfort. A healthy prostate is a gland that is used regularly and cleaned frequently. When we look at the big picture, the evidence is clear. Your private habits can be a powerful ally in maintaining prostate health. By understanding the prostate shield, you can replace worry with a proactive routine that supports your body's natural defenses. As we continue, we will explore how these physical actions also translate into profound benefits for your brain and your ability to manage stress, showing that the benefits of this practice extend far beyond the prostate itself. The benefits of maintaining sexual health in your mature years extend far beyond the physical structures of the body. They reach deep into the delicate chemistry of your brain. In our high-stress world, the ability to regulate your internal environment is an incredible built-in benefit of the human body. When we talk about neurochemical harmony, we are specifically looking at how the act of orgasm triggers a shift in your hormonal landscape that can lead to profound mental and emotional clarity. One of the most significant changes that occurs is the dramatic reduction of the stress hormone cortisol. Research has shown that orgasm leads to a significant drop in cortisol levels, which is a powerful advantage for aging men dealing with daily pressures. Lowering your cortisol is not just about feeling less stressed in the moment, it has implications for your systemic health. High levels of cortisol are linked to increased blood pressure and anxiety. By effectively lowering these levels through natural sexual release, you are utilizing a biological tool for cardiovascular and mental well-being. I often tell my patients that this is like a natural reset for the nervous system. When cortisol drops, your body moves out of a state of high stress and into a state of relaxation, allowing your heart rate to stabilize and your mind to quiet. At the same time that cortisol is decreasing, your brain is flooded with a cocktail of feel-good neurochemicals that promote a sense of vitality. Orgasm releases dopamine, the molecule responsible for motivation and pleasure, and oxytocin, often called the bonding hormone. In the context of self-pleasure, this natural mood booster provides an invaluable sense of well-being and emotional connection, which is vital for mental health. For many older men, this chemical release can be a crucial support, helping to provide a sense of well-being and emotional balance. Furthermore, the impact on sleep quality is significant. After orgasm, the body releases hormones like oxytocin and prolactin, which, combined with the reduction in cortisol, create a powerful sedative effect. This cocktail helps the body relax deeply, making it easier to fall into a restorative deep sleep. We know that as we age, sleep often becomes more challenging to achieve. Using the body's natural chemistry to facilitate rest is a sustainable approach to maintaining restorative sleep, something that is essential for overall health. It is also fascinating to consider the role of the brain as the largest sex organ. By engaging in sexual fantasy and focusing on physical stimulation, you are keeping the neural circuits associated with desire and arousal active. This is essentially maintenance that preserves your sexual responsiveness and libido even when you do not have a regular partner. It prevents the cognitive pathways associated with pleasure from becoming dormant. In my practice, I have observed that men who stay connected to their sexual selves through this neurochemical engagement tend to have a more positive outlook on aging. However, to maintain this neurochemical balance, we must also be aware of how we engage with external stimuli. If a man becomes overly reliant on extreme or unrealistic stimuli, such as high-intensity pornography, he risks skewing his expectations and making it difficult to connect with reality. This can make real-life connection or simple imagination feel less sufficient. The key is to balance any visual aids with your own imagination and memories of real, effective experiences. By doing so, you ensure that your brain remains sensitive to the signals of pleasure that your body provides. Ultimately, the goal is to use this practice as a tool for emotional and mental equilibrium. It is not just about the physical release. It is about creating a moment where your brain can find peace from the noise of the world. When you understand that you have the power to influence your own brain chemistry through mindful self-care, it changes the way you view your body. You are an active participant in your own neurochemical health, and this balance is the foundation upon which you can build a resilient and vibrant life. When we discuss the physical health of a mature man, we cannot overlook the structural foundation that supports the entire lower torso. The pelvic floor is a complex web of muscles that supports your internal organs and plays a starring role in your sexual function. The rhythmic contractions that occur during orgasm are not just a byproduct of pleasure. They are a form of engagement that strengthens key pelvic floor muscles, specifically the pubococcygeus muscle. As a physician, I view these contractions as nature's way of keeping the internal architecture of the male body firm and functional. A strong pelvic floor is vital for maintaining a high quality of life as you age because it serves critical functions: erectile function, ejaculatory control, and the prevention of urinary incontinence. Urinary incontinence is a common issue for aging men, but it is not an inevitable part of getting older. By engaging in regular sexual activity, whether with a partner or through self-pleasure, you are performing a natural exercise that keeps these muscles toned. This helps ensure that the muscles responsible for control remain responsive, preventing the leakage that many men worry about. Beyond bladder control, the strength of the pelvic floor is directly linked to the quality of your erections. For men who struggle with premature ejaculation, masturbation provides a safe and private space to practice techniques like the stop-start method. This practice allows you to better understand your body's signals and build greater control, which can then translate to partnered sex. Think of it as a training session where you learn to navigate the terrain of your own arousal, building the stamina necessary for a more fulfilling sexual life. Furthermore, masturbation enhances overall pelvic blood circulation. Beyond just the penis, this movement improves blood flow throughout the entire pelvic region, which is beneficial for the health of the bladder, the prostate, and the surrounding musculature. This prevents issues related to stagnation and poor circulation that can lead to discomfort. By keeping the blood moving, you are ensuring that oxygen and nutrients reach every corner of your pelvic anatomy, supporting the cellular maintenance that becomes increasingly important as we transition into our 60s and 70s. It is important to remember that these muscles, like any other muscle in your body, require regular engagement. If the pelvic floor is never challenged, it can become weak, leading to physical frustrations. This is why I encourage my patients to view their private moments as an essential part of their physical health routine. You are not just seeking a moment of release. You are actively strengthening the foundation of your urinary and sexual health. To implement this effectively, focus on the quality of the contractions during climax. Take note of the sensation of the muscles tightening and relaxing. Over time, this increased awareness of your own anatomy is one of the most effective ways to maintain control over your body as the years pass. This regular self-examination and practice of control help you remain intimately familiar with how your body functions. By treating your pelvic floor with respect, you are investing in a future of independence and physical confidence. As we move forward, we must also address the mental hurdles that can sometimes interfere with this physical progress. While the body is a system that requires maintenance, the mind is the pilot. In the next section, we will discuss how to navigate the potential risks of desensitization and the importance of ensuring that your practice remains a healthy, integrated part of your life rather than an emotional escape. Understanding these nuances is the key to a truly holistic approach to mature sexual health. While we have spent time discussing the physiological wonders of maintaining sexual health and maturity, a science-based conversation requires us to look at the potential risks if the practice becomes unconscious. As a physician, I believe a healthy practice is a conscious practice, which means being aware of the potential downsides to ensure it remains a beneficial ally. One of the primary risks we must address is social isolation. This becomes a problem when self-pleasure stops being a part of a healthy sexual life and instead becomes a substitute for real human connection. For men in their 60s, the convenience of self-stimulation should not allow for a withdrawal from the world. The solution is awareness. Ensure this practice is complementing your life, not replacing it. Another significant risk is desensitization. If you stimulate yourself in the exact same way with the same pressure and the same rhythm every single time, your brain can become conditioned to only that specific touch. This can make it difficult to achieve arousal or orgasm with a partner, whose touch is naturally different. To prevent this, I advise my patients to vary their technique, their rhythm, and their focus. Using different levels of pressure and varying the speed can keep your nervous system responsive to a wider range of stimuli. We also must discuss the trap of using masturbation as an unhealthy emotional escape mechanism. Using self-pleasure as your only tool to cope with stress, boredom, or frustration can create a behavioral dependency. While the neurochemical release is helpful, it should not be your only tool for life's challenges. It is crucial to have a diverse toolkit for managing your emotions, including exercise, meditation, and talking with others. When used as a mask for emotional pain, it can lead to a cycle of guilt and shame, especially for men raised with cultural taboos. If these feelings cause distress, speaking with a sex-positive therapist can help reframe this natural practice in a healthier light. Furthermore, we must be honest about the impact of pornography on the mature brain. If your practice becomes heavily reliant on unrealistic pornography, it can skew your expectations and make it difficult to connect with a real-life partner. The key is to balance visual aids with your own imagination and memories of real experiences. Your brain is powerful. Using your own mental imagery keeps your neural pathways flexible and grounded in reality. Finally, there is the risk of masking underlying medical issues. If you can only achieve an erection during masturbation but not with a partner, it might be tempting to ignore the issue. However, this can mask serious underlying health problems like heart disease, diabetes, or hormonal imbalances. If you notice this pattern, it is essential to see a doctor rather than relying on self-pleasure to hide signs of a physical change. By navigating these risks with honesty, you ensure that your path toward sexual health remains safe and truly restorative. As a physician, I view the private moments of my patients not just as relaxation, but as a critical window into their systemic health. For the mature man, the practice of self-pleasure makes you intimately familiar with your own anatomy. This is one of the most effective ways men discover early signs of conditions like testicular cancer, penile fibrosis, or other anomalies that might otherwise go unnoticed. In the clinical world, we call this self-examination, but in your daily life, it is a form of proactive vigilance. When you are engaged in the act, you are in a unique position to notice subtle changes in tissue texture or the presence of unusual lumps. Finding these issues early can be the difference between a simple intervention and a complex medical journey. I encourage my patients to treat these moments as a diagnostic mirror, a time to check in with their bodies and ensure everything is functioning as it should. Furthermore, the practice can serve as a training method for ejaculatory control. By using a private space to practice techniques like the stop-start method, you can better understand your body's signals and build greater control. This is more than just a skill. It is a way of mapping your nervous system and understanding your own physical responses. However, it is also important to be aware of red flags that can appear. If you notice that you are experiencing nerve compression such as genital numbness or pelvic pain, it may be a sign of poor posture. Many men masturbate while sitting in hard chairs or hunched over, which can compress the pudendal nerve in the pelvis. Over time, this can lead to numbness. The ideal is to practice in a relaxed, comfortable position, like lying down with proper support, to ensure you are not causing accidental harm. By paying attention to these physical cues, you are acting as your own first line of medical defense. We must also consider the health of the skin. Using self-pleasure to monitor for skin microlesions or irritation is vital. These tiny tears, often caused by aggressive technique or lack of lubrication, can become a gateway for infection. By being gentle and using quality water-based lubricants, you protect the delicate tissues. In my view, the man who is in tune with his body is far more likely to detect internal health problems, such as heart disease or diabetes, which often show their first signs in the form of erectile changes. I often tell my patients that their sexual health is like a dashboard. When the lights start to flicker, it is a sign to look under the hood. If you notice a persistent change in your ability to achieve or maintain an erection, or if the sensation feels fundamentally different, do not ignore it. These are biological signals that require professional attention. By using your private moments as a diagnostic tool, you are taking ownership of your aging process and ensuring that you remain vibrant and informed for years to come. As we bring this discussion to a close, it is important to understand that masturbation after 60 is not simply a matter of being good or bad. It is a tool in your health arsenal. Like any tool, how you use it determines its effect. The secret ingredient that transforms this practice from a physical release into a health-restoring ritual is consciousness. When practiced with awareness, respect for your body, and moderation, it can be a powerful ally for your health and vitality. As a physician, my goal is to help you integrate these biological needs into a lifestyle that promotes longevity and a deep sense of personal well-being. The journey toward healthy aging requires us to shed cultural myths and replace them with scientific understanding. By maintaining your biological engine, protecting your prostate, and finding neurochemical harmony, you are actively participating in your own health. You are ensuring that your vascular system remains elastic, your hormonal profile stays balanced, and your brain stays connected to physical sensation. This is not just about private moments. It is about how those moments empower you to show up in the world with more confidence and less stress. Remember that the most successful approach is one of balance. Listen to your body's signals for moderation to avoid pelvic congestion or physical irritation. Ensure that you are using high-quality lubrication and maintaining proper posture to protect your skin and nerves. Most importantly, keep your mind engaged by using your imagination and real memories rather than relying on unrealistic external stimuli. By following these guidelines, you turn a natural biological urge into a sophisticated form of self-care. Your sexual vitality is a flame that needs to be tended with consciousness. I hope this conversation has been helpful and has provided you with clarity. I genuinely want to know what you think. What was the most surprising point for you? Please leave a comment below so we can continue this discussion together. If you found value in this evidence-based advice, I ask you to like this video and subscribe for more straightforward guidance on mature health. Don't forget to hit the notification bell so you won't miss our next conversation. Take these insights and use them to build a life of strength and vitality. You have the knowledge to influence how you age. Be patient with yourself, be attentive to your body, and prioritize your health. I'm dear Emily Carter, and it has been an honor to share this journey with you. Stay healthy, and I will see you in our next video. We have covered a vast terrain, from the health of your cells to the peace of your mind. Now, as you step back into your daily life, I want you to carry this feeling of empowerment with you. Your health is your greatest asset, and your sexual well-being is a vital part of that treasure. By choosing awareness over silence, you are choosing a more vibrant future.